What is your profession?
I'm a radiologist.
And what path led you to become a radiologist?
Um, well, I went to college and I liked sciences, and then I went to medical school, and then after trying out a bunch of different things, I decided I wanted to be a radiologist.
Where did you earn your education?
I was in college for 2 years at Center College, and then 2 years of college at the University of Kentucky, and then 4 years of medical school at the University of Kentucky, and then my residency for 5 years at the University of Kentucky.
Can you explain the difference between residency and a fellowship?
Usually a fellowship is in one particular aspect of a field. So in my field, you do 5 years and you get exposed to doing things like mammography or special musculoskeletal radiology, which is just like bones and joints. And you get lots of training on that, but if you want to be kind of a specialist just in that particular area, you do 1 more year of fellowship just to be only do mammography or something like that. Just a little bit of a level of expertise for 1 year further.
Are there any other forms of specialization in your field?
Other than doing a fellowship, not exactly. That's the most specialized, is if you do a specific training in a fellowship.
What is a typical day or week for you?
For me, because I do both interventional radiology and general radiology, my days are very different when I'm on one rotation versus the other. So if I'm doing general radiology, I get to work about 7, maybe 8 o'clock. There are several cases to start the morning off that you look at, some of which were and read by a service kind of preliminarily from Hawaii or wherever. And we look at those ER cases, and then throughout the day, we read the other cases being CT scans, MRIs, mammograms. Some people have fluoroscopy studies where they drink barium, and that goes on throughout the day until about 4 or 5 o'clock. And then somebody else comes in to do the evening shift, and I head home. And on interventional radiology, it's quite different, and we do a lot of biopsies. Usually start the day with a biopsy of a lung biopsy or liver biopsy or something along those lines, and then do an arteriogram or something where you inject contrast and see the people's vessels. And so it just depends, but mostly that's the day. Depends on what I want.
Are there any other differences in your shifts, like night shifts or anything like that?
Yeah, they're usually at each hospital. We have several hospitals we cover. We have 2 people on for the day shifts, and then 1 person does the evening shift. When we do evening shift, we don't interact with the patients doing mammograms or any procedures or anything. It's just basically reading the films for the ER, and we do that from like 4 p.m. to midnight. The rest of it is just pretty much as I described.
Where do you work?
I usually work at Clark Memorial Hospital in Indiana, but I also work at Floyd Memorial Hospital in Indiana, and sometimes I work at Kindred Hospital, which is in Louisville. And we also we have an imaging center called Priority Radiology in Indiana, so one of those places usually.
What are the procedures that you do?
I talked a little bit about it, other than the interpretive things like interpreting x-rays and mammograms and CT scans and ultrasounds and MRIs. The actual hands-on procedures, lung biopsies, liver biopsies, thyroid biopsies. A lot of patients that have renal failure need dialysis, and sometimes they have shunts that get clogged up or don't run right, and so we do angioplasty to open up shunts. Also, patients that don't have a permanent access for dialysis, they need tubes in their neck or tubes in their chest called dialysis catheters, and we put those in. Sometimes people get clots in their legs, and so and then usually the treatment for that is to get on blood thinners, but sometimes people can't take blood thinners for whatever reason. So we put what's called an umbrella filter in the big vein in your belly, so do that. So lots of different kind of things.
Do you have any advice for a student pursuing radiology?
Study hard and be patient. It takes a while, but it's a lot of fun. I wouldn't trade my job for any other job. So my advice would be good choice and go for it.
What is the most interesting or weirdest case you encountered as a radiologist?
Can I do more than one?
Sure.
Once when I was a resident, there was a guy who had ridden his motorcycle, and he got flipped off his motorcycle and flew through the air, and he landed in a fence in a country road in eastern Kentucky. And he came in, and he had a piece of wood stuck through the side of his head into his brain, and the CT scan of that showed the wood looks like really different on CT scan. You can tell it's wood because wood has got solid parts and air trapped in it, so it's kind of like looks like lines. And it was perhaps the most interesting picture that I ever did. As an interventional radiologist, once sometimes people have what's called an aortic aneurysm, and they put in a graft, which is like a Gore-Tex tube that goes inside the aorta to try to block off the aneurysm and let the blood through the tube. Well, once a patient got what looked like an infection around the graft inside the aorta, so I put a needle in through the patient's back into the aorta, and then put a wire through that, and then dilated that up, and eventually put this tube to drain out what was pus around the graft. So putting a needle into the patient's aorta and hoping that it didn't bleed everywhere that's probably one of the most challenging, interesting things I've done.
All right. Thank you very much.
You're welcome very much.